Adjourn. Senator Fawcett.
Thank you, Mr Acting Deputy President. I'd like to just draw to the attention of the Senate some developments in the area of the National School Chaplaincy Program. This has had its ups and downs over the years, particularly in recent times. In June last year, people will be aware of the latest of the High Court rulings in Australia, where the decision was that payments that were made under the previous government's National School Chaplaincy and Student Welfare Program were invalid. The government, however, followed through with a commitment that it's had since 2006 under the Howard government for this program when it was established, to reshape that program and to work cooperatively with the states so that the program would be funded via the state governments, and the state governments would work with providers to then actually see that program rolled out into the schools. I've certainly followed this in South Australia, where the Schools Ministry Group provide this service fairly closely, because it has been a service that's been incredibly well received by schools and their communities. This year, the funding has been released during February, and South Australia has received $7.49 million to run the chaplaincy program. And as of the closure of the old program, there were some 369 schools in South Australia that were receiving funding, and this year there's 459 schools with funding for a chaplain. Now, that increase, I think, is significant for a couple of reasons. If we look just at government schools, so this is not private schools that might have a faith basis, just government schools, there are more schools this year who've applied for funding than there were last year. 338 government schools have applied this year, which is an increase of 26 over the last year. And so it's clear that those people who are directly connected to this program, so the parents, the school governing councils, the principals of the school, see the value in this and understand the benefits that it brings to the school community and to the children, which is why they have gone through that application process with the South Australian government to request the funding for a chaplain. So the South Australian government, to their credit, has seen the value of the program. The one downside for the program has been that with these increased applications, the state government has accepted all the applications, so those who want a chaplain get it, but what that has meant is that there have been less days available for any given school in terms of the support that a chaplain can provide. One of the significant things in South Australia is that because of the strong support for the program, the school communities and the faith-based communities have said, well, we need to close that gap. And so a program was run by SMG called Fund the Gap, where it's seen local communities donate more than $1 million to the SMG program, so that some additional 272 pastoral care workers, which is what the chaplains are called in South Australia, are able to actually work in schools. So what that means is that they're closing the gap in terms of the days that have been lost by some schools, getting the additional funding to provide this service to schools, which is really significant. The chaplaincy program has been very positive in South Australia. Even other states that I've visited where I've spoken to people, for example in Victoria after the bushfires in 2009, doing some work there with volunteers from South Australia, we interacted with principals of schools, and they indicated the strong support there that chaplains provided into the family. And that's reflected more formally in the study that was done by Edith Cowan University, as well as the University of New England. Now, this is a little dated, it's 2009, but the methodology and the approach to understanding the value that chaplains make still stands. And I raise this particularly because some people question why the federal government should be funding chaplaincy programs. And if you look at concepts of well-being, and this is not just a faith-based concept, this is a concept of well-being that psychology promotes. Positive psychology and other areas understand that there is an element of connection for people with their concept of spirituality, and that faith-based programs, or people who come out of a faith, can have value in that. Now, there's very strict guidelines around what they can and can't do. They can't push their own faith on people, they can't proselytise, but they do come with a worldview, a holistic worldview that has proven very supportive and successful for children, for the school communities, teachers, as well as for families. And I think it's worth noting that that worldview is equally as valid as the worldview of someone who has no faith. That's a worldview they have, that's how they see the world. People with a faith bring a different worldview, but as long as they work within the requirements of the program about not proselytising and pushing your faith, what we've seen in the results is that it's been very constructive and helpful for those communities. So this study that was done of the effectiveness, as I said, was undertaken by Edith Cowan and University of New England, and it looked at the number of activities that the chaplains did, and they looked at the professional development, admin work, miscellaneous activities, but also particularly the fact that 79% of the chaplains during that time had actually made off-site visits to parents and caregivers, bringing the broader community around the support the child needs. Some 73% had led events in schools and special ceremonies, but particularly the study looked at what the chaplains did on a day-to-day basis, and most frequently they were involved in areas such as behaviour management and social relationship issues, anger, peer relationships, loneliness and bullying, family relationship issues, self-development, sense of purpose, self-esteem and mental health, as well as the involvement of students in the community in dealing with issues such as social inclusion and racism. Most of the principals who made written submissions to the inquiry wrote about how they were impressed by the fact that pastoral care was provided in a non-judgmental way. They talked about the modelling and teaching of moral values and creating and nurturing ties with the community. And the principals recognised that as an important part for their schools. 84% of principals indicated that feedback from parents about chaplaincy had been strongly positive or mostly positive. 10% had said they received no feedback, and only 0.3% of principals said they'd received any negative feedback about chaplains. And parents in interviews said that they appreciated the pastoral care and the good moral influence that chaplains had on their children. And so, Mr Acting Deputy President, I just want to update the Senate on the fact that this program is alive and well. It has been supported on a bipartisan basis by the two major parties in this place in the past for the simple reason that it adds value. And whilst there have been critics about the funding model, hence the High Court challenges, I recognise there have also been critics about the fact that there should be qualified counsellors or people who are working from a secular worldview in these roles in schools. But the fact that communities in South Australia have banded together to raise $1 million since the start of this year in order to fund the gap so that these chaplains can work in schools, and we see that government schools, so not religious schools, government schools, have not only backed up from last year to say we want to continue, but an additional 26 schools have requested that support, indicates that the program is adding value. And so I commend it to the Senate and encourage senators from the crossbenches and both the major parties to continue to support this important element of pastoral care for young people into the future.
Thank you, Senator Fawcett.